everyone, and welcome back to Kikkawa College. My name is Alois and it's nice to see you back. And in this segment we are going to continue performing some of the most common musculoskeletal and neurological manifestations on our clients. Today I want to focus on the nerve flossing of the sciatic nerve, which is really a form of intermittent stretching for the sciatic nerve involved in or applicable in every chronic stage of sciatica. So what we need to do first is that we want to take the pathway of the sciatic nerve and place it in a this position, and that is typically done in supine position, where you abduct the hips, straighten up the knee, and then place the leg in a flex position. If the client is big, you can use your shoulder, of course, to help with the body weight. Feel the stretch here? Once we put the client in a position where they feel the neurological tension or the stretch in their hamstrings, we can take the sciatic nerve and then intermittently add to the stretch. So I'm going to accomplish that by plantar and dorsiflexing the foot, okay? And by applying the intermittent stretch to the sciatic nerve, we are going to prevent the type of unpleasant neurological discomfort that would occur if we place the stretch in a constant tension. So intermittent stretching or intermittent flossing for the sciatic nerve in this position and adding to the motion of dorsal and plantar flexion. The stretch is performed intermittently for about half a minute and should be done towards the end of the treatment for sciatica.